Hello again. Last video lecture, we talked about coding, and now we're going to talk about coding compliance. There have been a number of organizations that have been in the news for non-compliant coding. So we'll take a look at some of these situations and what we can do about it to have compliant coding. And again, this is a short summary presentation of chapter 13 in your text. Please take the time to read the entire chapter and review all the PowerPoint slides very carefully. This lecture will cover revenue compliance, particularly as it relates to health information. Some things we'll talk about are coding compliance issues that affect reimbursement. We'll be able to explain the Medicare improper payment review entities, structure audits for revenue integrity. We'll talk about compliance guidance for coding and billing, and we'll come up with an effective denials management procedure. One of the things that we talk about is fraud and abuse, and people throw these terms around very carelessly and act like they're the same things. They're related, but not entirely the same. What fraud is knowingly submitting a false claim for payment. So in other words, we know it's false. We know we're overcoding or upcoding to get more money. Abuse is basically an unintentional claim, and this could be because of poorly trained staff or technology that we don't monitor or what have you. And both of these are monitored by Medicare and compliance programs. Medicare claims and oversight and improper payments. Medicare with CMS and the OIG review claims, and some of the more common improper payment causes are missing physician orders, missing or illegible signatures in paper records, lack of medical necessity documentation. So I'll give you a couple of examples on this. A lot of times physicians say with an NICU, they'll order some sort of ventilation, or on premature infants, they'll write the order to start it. They won't necessarily write the order to take it off. That entire series of services may actually be denied by a payer. And another one that comes up with electronic health records is recently I was attending a conference and the patient wait issue was discussed. And in this case, again, it was in an ICU. In order to demonstrate medical necessity, the infant had to be admitted weighing less than a certain amount of money. However, since when they pulled the report to submit to the payer, the infant weighed, the weight given was at the end of the stay, a lot of times the infants didn't qualify to get in the NICU. So those entire stays were denied. And there's similar things you see with adult Medicare patients as well. Common coding errors that we talk about in HIM 260, unbundling. In other words, we're reporting separate codes instead of a single comprehensive code that covers the entire episode of care. And then upcoding. So we're reporting higher paying services than performed. And we always think of these as happening in the fee-for-service world. They actually are very common with Medicare Advantage plans that we talked about earlier. So people will submit, instead of something is a history of cancer, they'll code it as active disease and submit it, and then the claim will get denied. Some audit management and focus areas. We look at audits that reconstruct events for compliance verification. An example of this in the HCC world would be the risk-adjusted data validation audits, the RADV, where we're basically making sure that whatever the documentation is submitted is supporting the code that maps to an HCC. In a fee-for-service Medicare area, we might be looking at CC and MCC capture rates and coding accuracy. And when we come up with an audit plan, some things we want to look at is the sampling techniques. Is it going to be a random sample? Is it going to be a focused audit? Is it going to be stratified, cluster? And how we're going to calculate the compliance rate. Is it going to be by code, or is it going to be by patient, or by HCC, or so on? Some compliance tools that we can take a look at. In 1996, we had the National Correct Coding Initiative, the NCCI, which you've probably heard about in your other classes, particularly HIM 273. And this ensures that we have proper HCPCS and CPT coding. This is published quarterly and is also accessible online, as most of you know. And then relating to both hospital and medical offices, we have denials management. And this typically includes a team that includes HIM, physicians, coders, CDI, finance, and compliance. And the goal is to reduce claim denials, identify the source of denials, and most importantly, and often neglected, educate staff on documentation, coding, and billing regulations. There are actually health information professionals that specialize in denial management, and they work with the billing edits, the NCCI, claims appeals, and all these different things. So another potential area of employment for HIM professionals. And again, here's our friend, the dashboard again. This is tracking denial trends and the root causes. So we track those. And then again, we want to make sure that the goal is to have audit patient records to ensure accuracy and have compliant, efficient, and high quality data, coding, which leads to appropriate reimbursement and better patient care. And that's all I have for you. Please make sure and reread Chapter 13, both the text and the slides, to make sure you have complete understanding of this very important material. We'll see you online.